Hey everybody, we are going to talk about our 3 different Pneumo kits that we have in the department. We have a newer one, which is the Wayne's kit. We have the one that we've had for a very long time, the Pneumo, just the regular Pneumo kit, and then the small Cook Pneumo kit. So we're going to talk about the Wayne's Pneumo tray first. And so when you open it up, I'm going to show you what it looks like on the inside. So this is the actual catheter that goes inside of the chest wall. It has a pigtail, and so this is also called a pigtail. And this is the biggest one that we have at a 14 French. The physician will enter this into the chest space. They will connect this tubing here, just like this, and then this is the end piece that'll be outside of the patient. This you can connect to your atrium and to suction on the wall, or you can connect this to this one-way valve. All 3 of our Pneumo kits have this one-way valve on it. I'll tell you which one looks a little bit different, but the Cook catheter and the Wayne's look just like this. And it tells you what side goes what. So you insert this in, and what happens is that air is allowed to come out of the chest wall, but it cannot come into the chest wall, and it tells you exactly how to do that. The biggest piece for us to know is that there is a valve right here. This is a stopcock. This will be twisted on just like this. This stopcock should be facing off this way. If you turn it to off towards the patient or off to suction, this is essentially clamping the chest tube and will cause your patient to have a tension pneumo. If you have a stopcock, ensure that it is off to air at all times, and so that way it is open to your patient, so that way you do not create a tension pneumo. On this Cook catheter, this is what it looks like. The difference is that this one has a trocar. This is called a trocar, which is just really how the physicians are going to advance into that chest cavity. And then it has the same tubing with the stopcock on it, and then that same drain valve is there. On this pneumothorax kit, this is the 8 French. I'm so sorry. The Cook catheter is a 9 French. This is an 8 French. The Wayne's was a 14. On this one, physicians don't really like this one, so we don't use it very often. It does have the trocar on there. You can see the needle, and this is significantly shorter. The one-way valve is different. It's got your arrows. It tells you how to connect it, and then this does have the stopcock as well. If the physician does that, ensure that it's open to the patient and it's not off like this. Okay, so we have 3 different kits. It's all physician preference on what they want to use. Ask them the size and what kit they want. They will probably use the Wayne's. The only difference is the Wayne's can be used for small hemos as well. And so you think like 300 cc's in the chest cavity is what they would use this for. And then, but make sure that you do not clamp it. You keep it, the stopcock, open to the patient and off to air. Okay, thanks.